Welcome to the Share Hub YouTube channel. Let's talk about breast cancer. Breast tissue is composed of adipose tissue, milk-producing lobules, and secretory ducts that open at the nipple in the areola area. Abnormal growth of specific types of cells in the breast can lead to breast carcinoma. It can arise from the lobules or ducts. Breast carcinoma, the most common type of cancer among females, has a higher risk with 99% of cases occurring in women. Certain factors elevate the risk of breast cancer by influencing hormonal levels, genetic susceptibilities, and general health. Females with the following risk factors have a higher risk of developing breast cancer. Past history of breast cancer. Family history of breast cancer or ovarian cancer. Infertility. First childbirth after 35 years. Low parity. Not breastfed or breastfed only for a short period. Early menarche, before 11 years of age. Late menopause, after 55 years of age. Oral contraceptive pills usage for more than 5 years. Obesity. Past exposure to radiation. Breast cancer symptoms. In the early stages of breast cancer, there are often no noticeable symptoms, but as the disease progresses, symptoms may start to appear. Local symptoms of breast cancer can include a painless lump in the breast, changes in the size, shape, or appearance of the breast, and dimpling, redness, or pitting of the skin. Additionally, there may be an altered appearance of the nipple or the skin around it and abnormal or bloody discharge from the nipple. Presence of above features do not always indicate the presence of a breast cancer. Distant spread of breast cancer can lead to its spread to lymph nodes, often initially under the arm, though some affected nodes may not be detectable. Additionally, cancer can spread to other organs such as the lungs, liver, brain, and bones, potentially causing symptoms like bone pain or headaches. Let's talk about the methods to detect breast cancer early. Breast self-examination. Clinical breast examination. Mammography. Ultrasound scan. Breast self-examination is a method for regularly checking your own breasts for any changes or signs of breast cancer. Women over 20 should do this once a month. It's best to do it about a week after your period starts. If you don't menstruate, choose a fixed date each month. You can perform the examination while lying down, sitting, or standing. Breast self-examination technique has two components: inspection and palpation. For inspection, stand in front of a mirror with your chest exposed up to the waist. Observe your breasts for changes while your arms are in these three positions: hanging by your sides, pressed on your waist, and lifted above your head. Look for changes such as uneven breasts, skin changes, color changes, changes in shape, or changes in the nipple. To palpate the breasts, use the palmar surface of your fingers. For the right breast, lift your right arm and use your left hand to palpate it. For the left breast, lift your left arm and use your right hand. Start palpating in a clockwise direction from the outside towards the nipple. Then check in an up and down direction and in wedge-shaped patterns. Also, examine the armpit to palpate any enlarged lymph nodes. Finally, gently squeeze the areola with your thumb and index finger to check for any discharge. You should consult a doctor if you detect any abnormalities during a breast self-examination. Clinical breast examination is a key method for the early detection of breast cancer and plays a crucial role in the triple assessment process. Following a thorough patient history, this examination helps guide further investigations and confirms the diagnosis of breast cancer. Breast cancer screening uses mammograms and ultrasounds to check for problems in the breasts. Mammograms work better for older women, but adding an ultrasound helps find issues more effectively for women of all ages, especially those under 40. For younger women, ultrasounds are usually better than mammograms at detecting cancer. Recommended screening guidelines. All women should perform a breast self-examination once a month, starting at age 20. Clinical breast examinations are recommended every 3 years for women aged 20 to 40. For women aged 40 and older, CBEs should be done every year. For women with close relatives who had breast or ovarian cancer before age 40, annual clinical breast examinations should begin 5 years before the age at which their relative was diagnosed. Breast self-examination should be taught and reinforced at every consultation. From ages 50 to 69, women can request a screening mammogram every 2 years. Can be adopted only when adequate mammography facilities are available throughout the country. Women with a strong family history of breast and ovarian cancers can be offered screening mammograms or ultrasound scans every 12 months starting at age 35. For women younger than 35, an ultrasound scan should be offered instead of a mammogram. Any man with breast symptoms should be referred to a surgical clinic. Triple assessment involves 3 key diagnostic components: medical history and clinical breast examination, imaging techniques such as mammography or ultrasound, and non-excision biopsy methods like fine needle aspiration cytology or cone biopsy. Combining these elements enhances the overall sensitivity of the assessment, making it more effective than relying on any one component alone. Management options for breast cancer include several key treatments. Surgery can involve a mastectomy, where one or both breasts are removed, or breast-conserving surgery, which preserves the breast while removing the tumor. Radiotherapy targets cancer cells in the breast or chest area using external beams. Chemotherapy uses powerful drugs to kill cancer cells and is often used before or after surgery. Hormonal therapy involves medications that block hormones or lower hormone levels to treat hormone-sensitive cancers. Immunotherapy helps the immune system recognize and fight cancer cells, though it's used in specific cases. Lastly, palliative care focuses on relieving symptoms and improving quality of life for patients with advanced cancer. Each treatment is tailored to the individual based on the cancer's characteristics and stage. Together, we can make a difference in the fight against breast cancer by staying informed, supporting early detection, and promoting compassionate care for all affected. Thank you for watching the video. Stay tuned for more insightful videos and updates. If you have any questions, please leave a comment below. If there's a specific topic you'd like us to cover in the next session, feel free to let us know in the comments.